My name is Lena Hall, and I am a family nurse practitioner student, and I am doing my musculoskeletal examination upper extremity. First, we're going to start with inspection. So first, I'm going to inspect the symmetry of the upper extremities for any swelling, any discoloration, contours, abnormal positioning. I'm going to be looking at the overall upper body for any discoloration. I don't see any swelling, anything, deformities, masses, bony prominences. Next is have you flex your elbows about 70 degrees to inspect for, again, the contours and everything. So the elbows would be bent 70 degrees. Next, we're going to go to palpation, and I'm going to start by palpating, which would include me palpating the landmarks, muscles, tendons, and ligaments for any swelling, tenderness, bogginess, or bony enlargements. So first, we're going to start with the shoulders, and I'm going to start medially at the sternoclavicular joint, and I will be going along from the clavicle all the way down to each side of the scapula, palpating all down both sides of the scapula. And then I will be going from the end of the clavicular. I will be moving to the acromyoclavicle joint. So my thumb will be there, right there on both sides. And then I will be feeling for the coracoid process, and I will keep my thumbs on the coracoid process, and I will grasp the lateral aspect of the humerus to palpate the greater tubercle, and then I'm going to palpate the bicep tendon in the intertubercular groove, and then I'm going to have on each side, I'm going to have the patient lift up their arm and lower, and I will be able to palpate the subacromial and the subdeltoid bursa and the supraspinous, infraspinous, and teres minor. Okay. Next, I'll be palpating the elbow, which I will be palpating the medial and lateral of the epicondyle and the olecranon process. And do you feel any tenderness there?
No.
Okay. And I'm going to palpate for the ulnar, and between the olecranon process and the medial epicondyle. Okay. This side. Any tenderness when I'm pressing there?
No.
Okay. And next I'm going to do the wrist and the hand. So I'm going to palpate the groove of each wrist joint and thumb on the dorsum and medial lateral, which is the distal radius and ulnar. I'm going to palpate the radial styloid bone and the anatomical snuff box. There. Do that with this hand now also. There's no swelling, no abnormal bony prominences, no lesions, any tenderness as I'm palpating. Okay. And next I'm going to palpate the carpal bones and the metacarpals. Okay. And next I'm going to palpate the medial and lateral aspects of the proximal and distal interphalangeal joints, which is just little joints. Each finger. Medial is right there, and lateral is on top, medial is on this. Okay. This hand. No signs of osteoarthritis. Your knuckles aren't inflamed or anything. Okay. Next that's it for palpation. Next we're going to move on to range of motion. So I'm going to note your symmetry and the rhythm of your movement. First, we're going to start with your shoulders. So the first is flexion. So I'm going to have you move your hands in front of you and then over your head. Okay. And next is extension. You're going to take your hands and move them behind you like this. Okay. And then abduction, you're going to raise your hands that are going to be on your side and you're going to lift them up above you. Okay. And next we're going to do adduction, which is you're going to cross an arm across the body. This is sometimes known as a crossover test. So across your body. Okay. Across your body. Okay. No abnormal movements. He moved smoothly. Next, we're going to do an external rotation. So I'm going to have you put your arms up like a scarecrow, and then your arms are going to be bent 90 degrees, and you're going to rotate your forearms back up towards the ceiling. Okay. And then go ahead and put your arms on. And next, you're going to do internal rotation, which you're going to rotate your hand up in between your shoulder blades. Okay. Okay. Good job. Next, we're going to check the range of motion of the elbow. So we're going to, flexion is bending the elbow. Okay, bend your elbow for me. Okay, other side. Okay, no issue. Okay, and then I'm going to have you put your hands out supine like this. And then can you turn them down? Pronation. Turn it back up. Back down. Okay, good. Any pain or tenderness when you do that?
No.
Okay, next we're going to check the wrist. So we're going to check for flexion and extension. So first we're going to point our fingers downward and then flare your fingers up and then down. And now we're going to check the ulnar and radial. So for this you're going to ulnar and radial do. We're going to move your wrist towards your hand and then away. Okay. Next, we're going to check the thumb, which would move, you would be moving your thumb across to your 5th finger. Okay, good. Other side. Excellent. Now we're going to have you move your thumb from internally towards the palm. Away. Okay, good. And now abduction is you're going to move your thumb away. Try pushing on my hand. Your thumb. Thank you. Okay. And then touch each finger to your thumb, like this. Good. Now we're going to test your fingers. Flexion, we're going to make a tight fist. Okay. And then bring each one of your fingers to the heel of your hand. Okay, good job. Now for abduction, you are going to spread your fingers apart like this. Okay, and then bring them back in. That's adduction. And you have smooth and coordinated movements throughout all. So I see no issues with that. For the special tests, we are going to do the near impingement sign, which I'm going to press on your scapula with one hand, and then I'm going to have you raise your arm with the other. So I'm pressing on your scapula and I'm raising your arm. I don't feel any deformities or any sort of like pain or tension is expressed by the patient in their facial expressions. So I'll do it on the other arm. Okay. Now, so next is the Hawken impingement sign, which you would flex your shoulder and elbows to 90 degrees with them facing down. Rotate arms internally. Okay. And then the supraspinous, which is the empty can test. So you're going to elevate your arms to 90 degrees and rotate them inward. Okay, and then I'm going to press downward pressure. Okay, good. And then for the infraspinous test, your arms are at your side, your elbows are flexed at 90 degrees. So flex your arms at 90 degrees, and I'm going to push down on them. Okay. And then for the wrist hand test for carpal tunnel syndrome, we're going to start with the Tinel test. So I'm going to tap lightly on the medial nerve, and do you feel any numbness or tingling?
No.
Any pain?
No.
Okay.
No.
Okay. Next, we're going to hold our hands this inward, press into there. Do you feel any pain? You would typically hold this for 60 seconds, but for time's sakes, we're not going to. Do you feel any pain or pressure or
No.
numbness or tingling? Okay. And that is the upper extremity.